Another opportunity where I had the pleasure and honor of working with you was when we were putting together some amazing content in the name of Black maternal health.
Oh,
Mhm.
yes, I remember.
We
Yes.
know that Black women are at risk and have different adverse conditions when it comes to, their morbidity rates
Yes.
when
Mhm.
they deliver babies. And there's a healthcare system that we need to, implore all of the providers from us, from the hospitals to the from an administrative side down to the actual healthcare providers, to make sure that our Black
Right.
women are cared for. So it was so powerful for me to be able to be in conversation with you about that. And I know that you've worked in community health settings,
Yes.
literally
Mhm.
here in the
Yes.
community of Los Angeles. And I would just like to hear from you just overall, whether it's pregnancy, whether it's, health conditions that impact your community. How important is it for you to be a part of that advocacy?
The advocacy is my purpose. And so, my life, I've done a lot of different things. And when the story is being written, I can see how everything that I've done has led me to this moment.
Yeah.
And so, I love, public health. I worked for LA County, some time ago, and, I started going on social media trying to educate people because I started to realize the women that keep their well woman exams, that
Yeah.
do their screenings,
Yeah.
those, they don't need me. It's the people
That
that
aren't.
are not tuning into any health podcasts,
Yeah.
that are not able to get
I like
me.
that angle.
You
Like,
know what I
I'm
mean?
talking to the ones that aren't maybe thinking of this
No, and not
stuff.
at all, but
Yeah.
if they just see me in their feed, I'm like,
Yeah.
"Oh, okay, you know what? I do
Makes them
need to
think.
do that. I
Yeah.
do need
Mhm.
to keep up with my appointments," and
Mhm.
to my disappointment, we have a long way to go
Yeah.
Mhm.
as far as healthcare in America and not overlooking Black women. And
Mhm.
so I urge everyone, hey, if you know a doctor, if you know a police officer, if you know a teacher, you may think your kid has autism, you know, call that person.
Yeah. Talk
You
to them.
talk to
Yeah.
them.
I agree, and I think even
Okay.
someone hearing this, if this is the wake-up call for
Mhm.
us to start talking to each other so that we can
Yeah.
then have the conversations, book the appointments, ask the questions.